This startup is government and the name of Wnho. You know very well, sexuality is a natural and healthy part of living. Or out of this population, 90% are heterosexual. What do you mean by heterosexual? They are attraction to the opposite sex. And 10% are LGBTQ. What does L stand for the lesbian, female to female relationship. G stand for the gay, male to male attraction and romantic and sexual feeling. And B is the bisexual. They are male to male relations and they are, as well as they are male to female relations. And fourth important terminology is transgender. What is transgender? Is an umbrella term. People who don't wish to identify, because it's a gender identification is very important. This is own rights. You can be a homo, you can be a normal, you can identify yourself as a male or female, whatever you want. People who don't wish to identify as a male or female and wish to identify as both. They wish to identify either male and female both. These are called the transgender. In short, अपने local terminology में बोलते छक्के, transgender, like that. What is a queer? Queer is again our umbrella term, are not heterosexual and don't conform to gender norms. They don't come in the gender norms. They don't want to be male and female itself. They come all transgender, bisexual and homo. What is the intersex? Intersex term use people whose biological sex cannot be clarified, categorized either male or female. They determine their choice. If they want, they biologically they don't have these things. What you say, the gonadal development and other thing, they can determine their own as a male or a female, their own choice. Now, with this introduction, we go further as a basic in sexology. You know very well, every person is a sexual. And one thing you remember, during embryonic development, when the baby in the fetus form, sex determination after 2 to 3 months. When embryonic phallus, that is ectoderm, convert into the penis like organ in a male baby. If it is converted clitoris, then it's a female baby. Then how this scientific observation can be used day-to-day OPD basis? How you will use that indicate particularly key when suppose the male organ is formed by what? Male organ formed by the phallus. Similarly, female organ formed by the phallus. And that is the organ, sex organ in the female is not the vagina, it is the clitoris. So most of the time, patient comes to you, sir, my size is very small, I can't satisfy my partner. That is a myth inside the brain of male partner. Female partner has nothing to do it because their sex organ is a clitoris. If you give the clitoral stimulation, it is more than sufficient for them. But don't need, that means only 2.5 inch to 3 inch size of the penile shaft is sufficient to introduce inside the vagina. Vagina is just passage to carry out your penile penetration and further semen ejaculation. Now, my dear friend, if you know this much, you can understand, you can remove the myth from the patient's mind. Oh, most of the time patients say, sir, I can't satisfy. See my, please increase my size of the penis. No need of that. Tell them that that doesn't make any difference to your partner. Partner need love, romance, stimulations, foreplay, and sensory focus, and other things together. Step by step, we will teach you how to go ahead with the sensitive focus. But you understand this much. This is a today's home message that clitoral stimulation is sufficient to take your partner in orgasm. What happened mostly? Most of the patient comes because I am giving my experience, practical experience or OPD experience to you. You are getting me? Suppose if you have any doubt, just raise your hand. I will help you to explain particularly what our experience so far. I'm practicing since last 30 years in this field. Most of the time patient comes, sir, my size is small. There is a curvature. So little curvature is every penile shaft. If it is more, I'm getting now, I had one patient, he has totally curved penis due to fibrosis form due to the arginine deposit there, and that is just like what totally can't perform the sex, particularly this type of, and this is diagnosed by the sonography. And then what we do here in such cases, I applied shockwave therapy. Shockwave therapy, the function is shockwave therapy is that to break down the fibrous tissue inside the cavernous, that is the penile muscles inside the penile, and there are the various chambers particularly. This broken down gradually, and now after the 4 to 8 sitting, he's just slight change. He's so happy. Otherwise, it is mostly advised surgical intervention. But if without surgery, if he's getting good, normal is always better. So this can be used. You can see waiting room. Okay, fine. Now we will go ahead. We have seen so far the development, embryonic development of baby after 2 months to 3 months, the sex determination due to the phallus form, the penis, penile shaft, or clitoral stimulation. From that, we have taken the message: clitoral stimulation is the clitoris is the female sex organ. Forget about vagina. So there is no matter of size because you can stimulate from outside, from by finger you can stimulate clitoris and take your partner to orgasm level. Most of the time male get ejaculated very fast, within a minute. Erection is there, ejaculated. But female needs some time. Suppose male ejaculated in 10 seconds, the female need minimum 30 seconds. So you need to match these things. Premature ejaculation, very common. Anxiety, fear is a factor in that. Now we go ahead. I think I admitted everyone. Okay, fine. So now this much I want to be say you some things that is you may or may not be knowing the reality of in sexual myth and misconception should be removed from the mind of your patient. Now, next thing is a mental pattern expressed in every individual's sexual life. Sex, erotic fantasies and practices. It is unique for everyone. That is developed before the 8th year of age. Most of the time, you may feel that sex is over after adulthood, after the maturity, after 14 years of age, nothing like that. That's why I'm telling you the sex education on the particular level should be in school level, and they should know. It is a development before the age of 8 years and is executed after puberty. Children get their love map by engaging in sexual rehearsal play. When the play is not interfered with by parents or teachers or by the society, the love map develop as a heterosexual. Other, why the people are homosexual? Why they are attracted? Most of the time, bisexual are very common. Now the people are coming. They say, I'm gay, but I don't want to marry. But my parents, due to my parents' force, I'm going to marry. Please, you had to you need the counseling, not your patient. You need the counseling to their relatives. Explain them. If you marry, then it's going to be divorce in future. Please don't marry in such cases. 10% cases are now coming up because of the in Indian government passed the law of LG, lesbian, gay, bisexuals, transgender, and queer, or even community. Respect them, their own choice, their own right. If they accept it as a bisexual, let them. They are accepted as a gay, homo, let them. Because homosexuals are, even there are various score. Some are homosexuals, exclusively homosexual. You can't do in such case anything. Tell their relatives, he can't change. Those bisexuals make certain extent by counseling and other things you can guide and they can change. And that can happen before the age of 8 years, what I told you, that's why it's the most important part of the sex education. And secondly, even sometimes I had some patient, he said, sir, at the age of 10, I started loving undergarment of my uncle. I fall in love with my uncle. In such cases, is exclusively homosexual. There is no what evidence based homosexual, you can say in short. Evidence based homosexual is generally you get the cases when they come and stay in the same room, 2, 3, 4 males, particularly student, and they have started some doing what act like phenomena. At that time, you can say it is an evidence based homosexual. Now, my dear friend, if you understand your basic things, then you can practice it very well because you can ask these things to in your history taking. You can explain your patient, Baba, you are not suitable. You are suitable for this. You remain in that way. Don't marry. Be happy in whatever you choose your sexual identification. That is a gender identification. Okay, we go ahead. I will not take much time. Now I ask our today's presenters, particularly thus I will complete this. Values in sexuality is very, just what I explain you, and others are communication, self-image, gender identification, socialization, and body image, even male, just to be act like a female, particularly in your walking and everything and talking and everything and keeping hair long and all. My dear friend, I will not take your much time and will start with same thing is told by whom? Psychosexual response, Freud. Freud says psychology of sexual response start from birth, 0 to 1 year oral. Then 1 to 3 anal stage, 3 to 4, 5 year age phallic stage, 6 to 11 latency, 12 to 18 is genital stage. Oral stage. Now we go in depth in the oral stage. Age range birth to 1 year. Satisfactory zone is mouth. You start by sucking and all, and this same thing is reflected in adulthood by kissing and kissing the breast. They get the more and more erotic or orgasm level increase in a male. Now, you must understand the orgasm level is in 4 stages. First, the desire, then erection, then ejaculation, and orgasm. Mostly, we will explain in step by step. That is sexual response cycle. Anyway, second stage in psychology of sex is in which the child get the pleasure of eliminative functions associated with it. Same thing will be reflected in adulthood. This is based on whether they have some problem during bringing up them or teaching them. There may be some problem in future point of view. Anal sex is developed accordingly in that way also. You can think in that way also. Phallic stage, it occurs between the age 3 to 6 years. The word phallic comes the Latin word phallus, which means the penis. During this stage, pleasure focused on genitals as the child discovers the self-stimulation is enjoyable. And generally, this happened after particularly genital state, puberty onwards, they do the masturbation. And most of the time, people have the what myth give masturbation in my life. Most of the patient comes, I did the masturbation because of that, I'm not getting erection and all. That is a wrong concept. Please rectify this concept from the mind of your patient. Masturbation is just like a normal intercourse without lady. You explain in this way so that you can save the life of the patient. You clear the myth. If you clear the myth, 80-90% problem is due to the psychogenic origin. You can remember always. Premarital counseling, all this comes. This is psychological. But in practice, nobody gives time to the explaining each and everything to your patient. And patient goes worried, oh, I'm getting this, I'm now had the problem of erection, nothing like that. Now, next is we will see how this works particularly. Oral and anal stage is ego development. Ego is the conscious and subconscious mind. You know very well. Conscious mind is a 10%, 5 to 10% working. What I'm talking is a conscious mind. And subconscious mind is your 90 to 95%. Whatever comes on the surface level, conscious level, that reflected inside your subconscious mind. That is also called superego, id, ego, superego, and like that. Now, after this, we go to the today's session module. First, we said we had 4 types of session. Session 1 includes values in sexuality. Now, anatomy and physiology parts will be taken by Asutosh. Ashutosh Golik. Ashutosh is there or not? Dr. Ashutosh is taking this. Psychology of sexual response cycle. I will think maybe these are someone. Or sexual response cycle, neural mechanism of sex, hormones in sex and sexual problem, history taking and physical examination and investigation program in this month particularly. In next month, we will take complete second and third module, and in the month of November, we'll complete the fourth module, and we will take the practical test particularly, and they're very simple way, and we will send you all those are in attending the program. They get all the modules and all the counseling modules, personal evaluation of personality and reduction of the weight and other modules, calorie management modules, and all modules we will send them step by step. Those who are attending the course for them. Now, sexual is anal stage. It is the second stage of oral development.
Okay. Okay, yeah, so I will just start with the sexual response cycle. I will just give a brief description of, the history of this response cycle, how it started. So this model was proposed by Dr. William Masters and Virginia Johnson in 1966. And the 4 stages of model is through direct observation and recording of human sexual activity among couples and individuals in the laboratory. And it was basically, constructed based on the data collected from the physiological changes which correspond with the human sexual arousal and behavior during sexual contact in the laboratory. So you got 4 phases during this sexual response cycle, which consists of excitement, plateau, orgasm, and resolution. So the first phase is actually excitement. So this is through initiation of physical arousal, where physiological arousal begins to build up through emotional, mental, or physical stimulation. So in a common term, this is called foreplay. So basically, this is what the excitement phase is about. And during this phase, you will find increase in the heart rate, respiratory rate, blood pressure, dilation of the pupil, and you also have sex flush, that is a reddening of the skin in both males and females on the chest area, the breast area, and the back area. And this occurs generally more among the females compared to the males, the sex flush. And then you have the other aspects where, the difference is between the female and the male is in females, their labia majora becomes thinner and it parts and begins to flatten against the perineum, and their labia minora begins to lubricate and enlarge. So in males, it's quite similar, just as how it is with the females. You have the external genitalia swelling. So due to the dilation of the arteries, it actually promotes the movement of the blood to the penis and the scrotum, causing the penis to become erect and the testes to swell and lift closer up to the pelvic floor. So these are and also you have the nipples, which becomes erect in both females and male. And you have increased sensitivity to sexual stimulation in the area of nipple, external genitalia, and anus. And you find increased muscle tension, long duration. So this phase, this foreplay or excitement phase, is actually one of the longest phase among these 4 phases. Because and it's actually very important for a woman to have a longer phase of this foreplay to actually have a much more fulfilling and satisfied orgasm compared to a male. So the next phase is actually the plateau phase. So the plateau phase is actually just an extension of the excitement phase, but it's in much more increased intensity in physiologically and emotionally, mentally, or whatsoever it is. So what you find is basically it's the same thing. You find all the changes in the excitement phase, which is continuing towards the plateau phase in a much more intense state. So for female, you actually find that you have the continuation of the lubricant at the Bartholin glands and the swelling of the labia minora. And so there has been reported that there are also color changes in this labia minora among females, where there's a reddening of these labia minora, which is like, the more excited they become, the more, it becomes the change, you find it more evident. And wait, let me see. So female also continues to have this, parting and thinning and elevation of the labia majora during this phase. And the clitoris will retract during the plateau phase. And and also the vaginal wall will continue to display signs of vasocongestion, and the vagina increases in width and depth. Male will continue to experience vasocongestion of the external genitalia, where the scrotum will continue to enlarge and the testes will continue to elevate, while the penis size will also increase, but the increase in the penis size is not so much because the erection, most of the erection happens during the first phase, which is the excitement phase. So the size of the penis, there's not so much of a difference. Maybe it's just slightly much more erected. So, and then the males may experience the reddening of the external genitalia as well along the glands of the penis, and also increase sensitivity to the physical stimulation during this phase. And they will have a pre-ejaculatory secretion. So basically, what happens is, during this phase, if it continues, then it goes to the third phase, which is orgasm. So you need adequate stimulation during this plateau phase for you to continue into the orgasmic phase, which is the third phase. So that is very important. And so during this time, the orgasmic phase is actually considered to be the shortest phase among the 4 phases. And what happens is you have the sex flush on the skin continues, the hyperventilation and the increase of the heart rate continues. And during this orgasmic phase, what happens is you have an involuntary muscular spasm of the muscles around the neck, arms, abdomen, buttock, leg, and face. The vaginal and uterine contraction also occurs, where the uterine lifts from the pelvic floor, and greater frequency and intensity of the contraction are associated with, so if the person is having a greater intensity during the contraction, it is been studied that, maybe the orgasm is also much more intense. If the frequency is deeper, longer and more frequent, then, the orgasm might be more intense among women. And then in the male orgasm, it's also the same. They also have the sex flush, they have the hyperventilation and increase in the heart rate, and they also have the total body muscular spasms. But what is different among the female orgasm and the male orgasm is that the male actually ejaculates the expulsion of the seminal fluid through the urethral meatus. And you have, so there's a study saying that the greater variation in both the intensity and the duration of female orgasmic experience, but there's not much difference in males. That means females can have different kind of variation in their orgasmic experience, but the male is not so much of a difference. They pretty much have the similar kind most of the time. So the last phase is resolution. So the resolution phase is actually just the opposite of the excitement phase, where you actually find the disappearance of all the physiological characteristics which happened. So basically you'll have a lower respiration, the respiratory rate will go down, the constricting of the pupil, lowering of the blood pressure, and slowing of the heart rate back again. And for the females, the sex flush and the reddening, the rate on the skin will disappear, but the swelling in the breast due to the vasocongestion may actually decrease much lower compared to the other part of the organs. So the clitoris will return to its normal state, which is the unretracted state, is the similar as the male, where the shaft of the clitoris relaxes. And for a man, the shaft of the penis following the ejaculation will also relax. Then the vagina will decrease in diameter. The uterus lowers towards the pelvic floor, and the lubrication of the labia minora and vaginal walls ceases. So basically, in male, the experience of resolution is typically characterized by the rapid loss of penile erection. And during this phase, the sex flush on the chest, neck, and back disappears, and the scrotum lowers. Testicular size decreases, and the testis descends lower into the scrotum. So they also found that, significant variables in males' ability to achieve multiple orgasm in a short period of time. That means there are men who can actually orgasm a few times, but it also depends on their age. So as they grow older, the resolution time will probably get longer and longer, and it'll be harder for them to actually get another stimulation or erection as they get older. So this basically sums up the sexual response cycle, the 4 phases of it. Thank you.
Very nicely presented. And, Niza, you are very good. I think you should be honored. And
Did you understand? Aishwarya, did you understand?
now, Aishwarya, please introduce yourself and your NLP, what you are doing in NLP and how it is effective in the case of sexual problem in counseling.
Okay, yeah. So once again, good evening to all of you. Myself Aishwarya, and then Sir has requested me to give a few words regarding what I am doing with regard to NLP. Okay, so I don't know like how many knows what exactly is NLP. NLP stands for Neuro Linguistic Programming, and it is in fact a psychological approach. It is a set of psychological tools that involves in analyzing strategies to reach success. One of the presuppositions that we actually depend upon is that, if you can do something and you are successful, then definitely I can also do it. I also have all the resources within me which will actually help me to be successful like you. It's kind of a modeling. This is one of the biggest concepts in NLP. And NLP was formulated, it was coined in 1970s by John Grinder and Richard Bandler. John Grinder was a linguistic and Richard Bandler was an information scientist and a mathematician. They also took concepts from some of the famous people like Virginia Satir. She was a family therapist, and then Fritz Perls, and also Milton Erickson, who was a hypnotherapist. And NLP, in a way, provides practical ways of helping you to change the way you think, the way you see your past events or experiences, and how you perceive or approach your life. So this is very simple. This is one of the simplest way I can put what NLP is. Unlike psychoanalysis, I know that there are psychologists here. So unlike psychoanalysis, see what happens in psychoanalysis. Whenever you are confronted with a problem, you actually focus on the why of a problem. But NLP helps you to focus on how of a problem situation. It's basically about how you take control of your mind. Usually you cannot control what is happening in your life, right? But definitely you can control what is happening in your own mind. It's basically a connection between what you think. Neuro is thinking, linguistic is your language, and behavior is your pattern. So there is a concrete relationship between what you think, what you speak, and then what you behave. and what is your pattern. It's always said that anything that is done more than twice is a pattern in you. For example, there are people who wake up in the morning and then they tend to lie on the bed for some time and then wake up and then get out of the bed and do their morning chores. That is a pattern in them. There are people who would like to wake up from the bed and immediately jump out of the bed and go and make tea. So that is one of the pattern or a behavior that is running in that kind of a person. So it's like, every person you are programmed. Every people is programmed from the day you are born. And every behavior is learned. Other than, there are only two behaviors that comes along with you when you take birth, like, it is a fear of abandonment, it is a fear of being alone, and also the fear of on hearing a loud noise. So these are two kind of fears or behaviors that you bring along with you when you are born. Rest everything in life, it is learned. And one of the scope of NLP lies here, that is, if every behavior is learned, there is a possibility for you to unlearn all your behaviors and also to relearn your behaviors. So this actually contributes to one of the key factors of NLP. And if you ask me like where all I am using this concept of NLP, right now I am working as a psychotherapist in a hospital and I am running my own clinic here. I look into anxiety, depression, and all kind of psychological interventions. Along with that, I am also working as, or maybe, at times I freelance as my mental skills trainer in the field of archery. I am the mental skills trainer for Kerala State Archery Championship programs and also for badminton. So this is also one area. Even in sports, you can use NLP, like in counseling, and then in psychotherapy, medicine, law, business, performing arts, sports, any area you tell me, you can actually blend NLP into it and see how it works. Basically, NLP will help you to differentiate between what is a belief and what is reality. And it will help you to establish proper communication between your conscious mind and unconscious mind. That is one of the key factors of NLP. For example, you go to some other country and then you don't know what the language they speak, or maybe you don't understand what they speak. You get into a restaurant and you order for a food, okay, thinking that it is a steak. And once the food is delivered on the table, you find that it is not steak, it was something else. This usually happens when you are in a country where you doesn't know anything about the country, you don't know the language, and then you end up having something else on the table. Same thing happens with you also. In the mind, you are thinking that you are actually ordering up, or you're actually willing for something good, a proper relationship, immense amount of money, a wonderful career. These are things that you think that you are programming yourself. And at the end, when you get the real thing in your life, you understand that yes, there was a communication gap between what I wanted and what I got. Here comes NLP, and NLP can, very well train you, like what you are supposed to think, and what is the perfect way of putting it. What are the right words that you can use to manifest or to get what you want. So this is again one of the, beauty of NLP. And if you ask me where exactly can we use NLP in psychotherapy, I don't know. I am still not that great with this sexual part. I mean, the sexual dysfunctions, because some of the areas which I am familiar is like, what is that? The erectile dysfunction and then vaginismus. That's it. I don't know much about it. But then if I sit and think, I can tell you that NLP can be blended into isolating any root cause of any of the issues that the patient is suffering. And I've noted on something like, NLP can help you to heal any past trauma or past negative experiences with regard to the sexual issues. Then it can help remove any mental pressure around intercourse and performance anxiety when it comes to the sexual intercourse. And also with NLP, we can help our patients to trust their own body, feel relaxed before and during the sexual experience. And then NLP can also come into shift patterns of past behavior when it comes to sexual intercourse and when it comes to the relationship between the couple. Remove negative emotions surrounding sex, that is any kind of guilt or fear or performance anxiety, pressure, whatever it is, any kind of emotions. NLP can help and cater to it. And then to improve the body image of a person, which can be a problem for him to get into a proper relationship. Improve his self-esteem, self-belief, confidence. See, we have techniques called as anchoring, which we actually use to install all these kind of emotions or states or resources to a person. We have lot of therapies like belief change exercises, wherein we actually get into the subconscious and then help them take out the limiting beliefs and install another helpful belief or resourceful belief instead of the limiting beliefs in the person. And then for relaxation, then self hypnosis, and to move basically from a negative loop to a positive loop. And then we have also seen that sexual dysfunctions are always associated with anxiety and depression. So this is also one area that NLP can beautifully tackle. So if you ask me, one of my experience I can share with you. I hope that we all have time to hear that also. So I'll quickly share one experience which I had with one of my clients. So this was a couple counseling, and then they had been into the process of counseling for about 3 or 4 months, and nothing was turning up. And finally, they reached my clinic, and then I happened to talk to both of them. And in the course of counseling, I happened to talk to one of their friends as well. I think I've shared this with Nissa also. So, and that friend of the patient, that man, he told me that, madam, when I was actually in a group with him, he was asking me that, by any chance, are you a bi? So this was that statement which this particular man, my patient, he asked the other one that, by any chance, are you a bi? So this is where I actually could bring a breakthrough in the case, because according to NLP, we actually work on certain presuppositions, and one of the presupposition is that you spot it, you got it. In the sense, if you see something in somebody, then you have to understand that that is there in you. So this is one concept on which we work. So immediately I started feeling that yes, since he has asked him the question that by any chance are you a bi, I was actually feeling that yes, so this man is into some kind of sexual orientation. Maybe he is also a bi. So that was actually a breakthrough or a turning point for me. And then on further investigation, and then on further counseling and therapies, we actually figured out that that husband was a bisexual. So this is where NLP can actually help you in cracking the case. So this is one of my experiences. And now, as sir was telling us a few minutes back, they are actually not having a proper relationship, because the wife also understood that he can't come back and be with her. And he is a bi, but then he is more inclined towards men. He is not much interested in ladies, but with men. And now they are living separate. They are together, they have kids and all, but then they are living a parallel life. So that was one of the breakthroughs I had. And there are many. If you want me to share, I have a lot of cases like this, wherein we actually put the psychological tools into this and try to cater. And what more I should say? Any doubt? Anybody wants to ask something, you can ask. Sir?
Yes, okay, very nice. I think one John is having some. He's raised the hand. We will unmute him. I ask him to unmute and himself, and he may ask you some.
Yeah.
You are presented very nicely. Aishwarya, you are presented nicely.
Thank you,
Very
sir.
nice. Very nice. And both the presentation is very good. Now, what happened? Dr. Pawal is not here. Dr. Praveen Pawal. And
I'm there, sir.
Yes, just present yourself.
Yeah, I will start presenting.
Yeah.
Yeah, I am sharing the screen. You have disabled my screen sharing. Can you enable it?
Okay. Now, what I had to do? Tell me.